Hello friends, welcome to the channel The World of Ayurveda. Continuing with digestive system, today I will talk about common problems which occur during the digestion of the food at the level of stomach. In previous episodes, I have already talked about one very common problem, that is acid regurgitation, technically called as gastroesophageal reflux disease, in which the acid content of the stomach comes in the esophagus because the gastroesophageal sphincter is not competent. It does not close during the movement of the stomach. As a result, the acid comes to the lower end of the esophagus. Now, this problem is very common and commonly associated with burning in the epigastric region as well as acid regurgitation in the esophagus and sometimes into the mouth. To fight this problem, it is important that the sphincter control is maintained, which is of course not very easy. Therefore, to find the shortcut out of it is one should take small frequent meals, and especially the meals which are more liquid in contents. Acid foods or the sour foods, spicy foods, fried foods, food which are difficult to digest should be avoided. At the same time, one should not indulge into the act of regurgitation, should not lie down just after taking the food, should not sit in squatting position, should not strain much on the full stomach, and if required, some drugs which reduce the acidity of the stomach can be taken. Among this group of drugs which reduce the acidity of the drugs commonly are the shank preparations described in the Ayurveda. This can be shankbati, this can be kamdudaras, this can be jarmorapishti, and some herbal preparation like madhujasti churn, like shatabari churn can also help to fight this particular problem. The other problem in the stomach is, of course, again the hyperacidity. But in this particular case, we only feel the burning sensation in the epigastric region. And sometimes this burning sensation may be associated with pain also over there. This we commonly call as hyperacidity. Now, the problem of hyperacidity is increased if one indulges into acidic food, takes a lot of spices, fried foods, and of course the junk foods. Because the HCl content in the stomachs are high, it is better that we neutralize that acid to save the acid barrier of the stomach. Now, this acid can be neutralized again by the preparations which contain madhukshar, which contain shank preparation like shankbati, shankvasam, mukta shukti. This can be jarmorapishti, or drugs like madhujasti churn, shatabari churn again can be helpful for this particular problem. Now friends, the other very common problem which are also sometimes confused with acidity problems may be associated with excessive or delayed movement of the stomach. Now when the stomach movement are less or very less, which we commonly designate by the term as hypotonic stomach or gastroparesis, the food stays in the stomach for longer time. And this longer stay of the stomach in the acid medium leads to fermentation of the food. The problem of the patients are usually the fullness of stomach comparatively for a longer time after taking food, and then he starts with the problem of acidity not immediately after taking food but after few hours of taking food. Now if we give the acid neutralizing drugs in such particular patients, they may also help. But the need is to improve the gastric emptying so that stomach puts its contents into the intestine at shorter duration, and we can fight the gastroparesis over there. In my opinion, the carminative drugs can be of much value in this particular condition. The drugs like avipattikar churn, hingvastic churn, they can be of much value in fight, or even the mridugurachik drugs, they can be much value in fighting this particular problem along with the acid neutralizing drugs. The other common problem is the gastric erosions, or when there is high acidity and there occurs gastritis or gastric erosions, which we commonly call as anadrav shul. Now, to fight this particular problem, we need to have certain drugs which reduce the pain as well as which reduce the acid and also repair the gastric lining. In this particular category, for reducing the pain, ajmodadi churn, ajwain arc, they can help a lot. But to repair the gastric lining, you require drugs like again madhujasti churn or shtavari, or some shank preparations over there like shank vasm can also be of much value for the patient. Similarly, there are certain conditions when the stomach does not produce any acid. As a result of it, there can be the problems of food not being properly digested inside the stomach. In all such condition, previously they used to give dilute hydrochloric acid to the patient, but that practice is now stopped. All the drugs, especially the B12 drug, which is not absorbed when the acid is not over there, this can be given as a substitute in the diet. But in all those people who have got very low acid in the stomach, the food should be very clean and it should not be contaminated with any ova or cyst of any organisms which can cause damage to the intestine or can inhibit the intestine over there, because we have lost the acid barrier over there. So these are very common problems, and most of the time the problem of the stomach is not understood by the individual and not understood by the physician properly, and patient is subjected to medicine for longer durations. If we do the food correction, but to be eaten but not to be eaten, and give the simple medicine after understanding whether it is the high acidity in the stomach, whether it is the injury to the gastric lining, whether it is the delayed emptying of the stomach, and choose our drug accordingly, I suppose the patient can benefit a lot. And I suppose the principle of Ayurveda are very clear on that matter. Thank you. I would like to get your feedback on the email of this channel. The email is the Ayurveda helpline at gmail.com. I will repeat it, the Ayurveda helpline at gmail.com. Thank you.